Football, or soccer, is the most popular sport on the planet. Widely known as a beautiful game, it is played all around the streets, beaches, and fields of the world. The first football association was formed in England in 1863 and has continually branched out to every country ever since. It has inspired hundreds of million people across the globe to play competitively in the hopes of becoming a professional player.
With that potential reward, however, comes a lot of risk. Football is known to be among some of the most injury-prone sports, along with American football and hockey. Concussions, muscle tears, and ligament sprains are not uncommon within the sport, and in some cases, injuries can be life and career altering.
Hi, I'm Hansen.
And I'm Kevin. And today, we're going to be talking about one of those career-changing injuries.
During a 2026 World Cup qualifying match between Brazil and Uruguay, Brazilian player Neymar da Silva Santos Jr., more commonly known as Neymar, suffered a severe knee injury.
Marcação, o Marquinhos fora da área, marcando o Max Araújo, tem giro em cima dele e dentro da área, Gabriel Magalhães deu espaço demais para o Davi Nunes.
If we look at the injury more closely, we can see that Neymar was pushed off the ball by Uruguayan player Nicolas de la Cruz when attempting to dribble around the middle of the field. After being pushed off, Neymar seemed to land in an awkward position when trying to regain his balance with his left leg. Following this landing, Neymar immediately fell to the ground, yelling in pain knowing that something was wrong. And after undergoing many tests the next day, Brazilian's national team doctor Rodrigo Lasmar spoke to the press about his injury, stating that Neymar had fully ruptured his ACL and meniscus in his left knee. Going deeper into the injury, the ACL, or anterior cruciate ligament, is one of two cruciate ligaments that stabilize the knee joint by preventing excessive forward movement of the tibia and limiting rotational knee movements. Thus, with a full tear, the patient can now move his leg outside the normal range, both rotationally and vertically. A full rupture, similar to the tear Neymar suffered, will result in instability in the knee that will cause feelings of buckling and sudden shifting. Additionally, there may be both swelling around the knee joint and blood clots in the thigh or calf that develop after reconstruction surgery.
Regarding the meniscus tear he suffered, the meniscus is a C-shaped piece of cartilage that functions as a cushion to keep the knee joints from grinding against one another. It is vital for making sure weight is distributed evenly across the knee joint. Thus, a torn meniscus can result from any activity that causes you to forcefully twist or rotate your knee. Left untreated, it can result in lasting knee pain and instability, as well as an increase in the risk of osteoarthritis. Typically, an arthroscopic partial meniscectomy, or an APM, is done to remove torn meniscus fragments and trim the meniscus back to a stable rim to relieve those painful symptoms.
Now for a recreation of the injury. Next, we interviewed BCA's trainer Jen in order to find out more about these injuries. What exactly causes an ACL and meniscus tear?
All right, so the ACL, first we need to know the mechanism of what it does. So the ACL prevents anterior translation of the tibia on the femur. So usually a tear of the mechanism of injury for ACL, meniscus tear is a plant and twist type motion.
What are the treatment options for people who fully suffer a fully torn ACL compared to those who suffer a partial ACL tear?
So a fully torn ACL needs surgery to fix that. So usually it's a bone, tendon, bone surgery to fix that. Now, some people who only have a partially torn ACL can maybe potentially rehab, unless they're a high-level athlete. Most high-level athletes or athletes will need to be fixed.
Going into the science behind the injury, we can calculate Neymar's speed at the time by looking at how far Neymar went and how much time. To do this, we looked at the dashes between the different colored patches of grass on the field and determined that they were 6 yards apart due to how many different sections of colored grass there were compared to how long the field is. Then, by timing how fast Neymar went, we know that he went around 10 yards in roughly 1.51 seconds, giving him a velocity around 6.10 meters per second. And because he weighs around 68 kilograms, his overall momentum, which is mass times velocity, was around 415 kilograms times meters per second. Using the same method for De La Cruz with the player that hit him, we know that he was going at around 5.9 meters per second while weighing around 64.9 kilograms, meaning his momentum was 382.7 kilograms times meters per second. And so, by using vector addition, we can conclude that Neymar was experiencing a momentum of 797.7 kilograms times meters per second when he landed awkwardly on his left leg. The impact this injury has on both Neymar's national and club team is very apparent. Due to the severity of it and Neymar ultimately opting for surgery, the long recovery time and rigorous rehabilitation will cause Neymar to miss out the rest of the season with his club team Al Hilal SFC. While this may not impact his club team as much as they are on track to win in their own respective league, it is more detrimental to the national team. Neymar will have to sit out the 2024 Copa America with his native Brazil as well as many World Cup qualifying matches. A couple years prior, and maybe even now, Neymar was regarded as one of the best players in the world, so his loss to both club and country may severely impact how well they do for the rest of the season and for however much longer Neymar may potentially be out. Thank you for watching.